Good afternoon, everyone. Can everyone hear me okay? Thank you all for joining our Early Childhood Update webinar today. Today is December 18th, and I am really happy that we can have, I'll call it our holiday edition. I think we do have some good news we are happy to share with you all today. And we'll go to our agenda. I'll share what we'll be talking about. And so today we will have a welcome from our State Superintendent of the Department of Education, Dr. Cade Brumley. We're really excited that Dr. Brumley is able to join us today and just share some updates around the pandemic and to say hello to everyone. We'll then move into some COVID-19 resources, some reminders, and some new items. We'll have a guest speaker talk about the Binax Now rapid testing. We'll give some COVID-19 vaccine updates. We'll have another guest speaker talk about some business tax considerations for you all as we end the close of the year. And we will round that out with some program, food and nutrition, and teaching and learning updates today. So with that, I will gladly turn it over to Dr. Cade Brumley.
Thank you, Dr. Chasson. It's an honor to be with all of you today. Let me just start out by thanking you all for the work that you have done. Well, you've always done, but certainly over the course of this pandemic. I had the honor of sharing with the legislature just yesterday the importance of what you do and simply the fact that so many of you are back open in operation. And that, for me personally, like I know how difficult that has been for you to accomplish. I know that the work that you have done have completed has been difficult, and I know that I believe, and I hope the rest of our state believes and appreciates the importance of the work that you do every day to stay open and serve your families and local communities. I think that we have tried our best to be thoughtful in our support for you, in our advocacy for you, because we know that you're getting the work done there in the field every day to serve kids. So for that, I am especially thankful. If there's any particular way that we can support you, not listed and within our ability to do so, we want to do that. So let us know. One thing I just want to share is in terms of the vaccine. Really good news on the vaccine front that is beginning to flow into our state. You may have seen my request to the Department of Health and to the governor's office that early child care workers, pre-K 12 workers, everyone in that birth to 12th grade category who serves children, that they are included in priority access to the vaccine. And so it's 166,000 of us, and I can't think of a demographic that we don't hit in terms of all of our employees, and we certainly, on a proportionate basis, spread out across the entire state. So I'm hopeful that as those decisions are made, that you all have access to the vaccine in priority fashion. So you're going to hear a number of other updates, some of which were just recently passed at our state board meeting, which are all good things. And just wanted to jump on at the end of the year as we turn into a new calendar year and say thank you. I appreciate you, and I'm glad that Dr. Chasson are here with your team leading, because I know how committed they are to supporting you, and we'll get through this together. So thanks for a few minutes.
Thank you, Dr. Brumley. Thanks for joining us today. So we will move into our webinar, and as we do, I just want to remind everyone, as our last few webinars, please feel free to enter questions into the chat as we go through today's presentation. We will be stopping periodically to answer questions, so please do not hesitate. Post your questions in the chat. We are happy to answer them. And so just a reminder that we have resources and materials used to support lead agencies, schools, and all providers. Located on our website on louisianabelieves.com, we have a COVID-19 landing page, and we have some specific early childhood information in there, including our dynamic FAQ that has been updated since our last webinar. And we are going to do a holiday poll. And the poll should now be appearing on your screen for our holiday edition webinar. What is your favorite holiday tradition? Is it baking cookies, singing carols, shopping for gifts, wrapping presents, celebrating with family and friends, or visiting Santa? And it looks overwhelmingly like the answer is celebrating with family and friends. I know this year is going to look different for many of us, but I am hopeful that everyone on this call is able to take some time to celebrate with family and friends, even if that looks a little differently this year. I know how important it is to all of us. I will definitely be doing that, spending time with my husband and my 3 young kids, which is fun to have 3 children around during the Christmas season. So I hope everyone can take a well-deserved break to do that this year. And so now we are really fortunate to have as a guest speaker today from LDOE's Office of College and Career Readiness, we have Meredith McGovern, who has been working really closely with LDH since the spring to really be that liaison and one of the voices advocating for what we are receiving as educators and for information. And so Meredith is here with us today to present some information on the Binax Now rapid testing for childcare. So Meredith, are you there and can you unmute?
Am I unmuted? Can y'all hear me now?
Yes.
Okay.
Now you are, Meredith.
Thanks. Yeah, we're really fortunate that we've developed such a fantastic partnership with the Louisiana Department of Health as we've navigated all of the craziness that this year has brought. And one of the resources that they are actually providing for us about a month ago is these rapid testing kits that our school systems are using, and they're now available for childcare. So if we can go to the next slide and I can briefly let y'all know about them. So they have these Binax Now rapid testing kits that are available for you to request. There is a survey that you have to fill out, and the link is available on this slide. And the survey asks for basic information, a point of contact, address, your general email address, information like that. But it does require that you have either a CLIA waiver or you have a community health partner that will assist you in administering these tests. If you need a community health partner, if you reach out to Rundy at la.gov, her email is at the bottom of this. She is doing a fantastic job of identifying community health partners for our school systems and has offered to do the same for our child care providers. So if you are in need of that, the first step is to fill out the survey. The second step is to email Rundy and let her know that you are in need of a community health partner, and she will get you matched up with somebody. On the next slide, we have some resources available for Binax Now. And real quickly, I'm not a medical professional, but they have been explained to me that these are self-administered tests, so they do not need to be done by a medical professional. They are free. It's a quick nasal swab, and it's a little credit card envelope that you put the nasal swab in, and then you put a drop of a provided liquid in. You wait 15 minutes and it comes back and it tells you if it is a positive or a negative. They do caution that if you receive a negative test, because they are an antigen test and not the molecular one that they provide, that you counsel whoever you gave the test to please seek out a PCR or molecular test to confirm the negative results. These are being provided free of charge, so you can request them. They do have an expiration date on them, so whenever you get them, make sure you're aware of that. If you need training, we have provided resources for people who are going to administer these, and those are available on an LDH created document where they will take you through a series of training videos and link you up with the manufacturer to provide you with more information. Additionally, we have created a LDOE FAQ document. And I think if you'll go to the next slide, I believe they're linked on that, which covers the operational questions. Those include, do you need parental permission? The answer is yes, you should work with your legal counsel to develop some language for a parental permission slip. And then also, what do you do as regards to reporting? So you do have to report the results, and your community health partners should be able to help you do that. And we take you through the steps of how to report the results, and we provide you with LDH contacts to help you facilitate the reporting of these results. So we're very excited about this. If you fill out the survey, we send in the requests to LDH every Friday. So it is a rolling request once a week. We submit them, and they will work to get them distributed to you. And the contacts available for this at LDH are extremely helpful, and they will answer emails as quick as they can, and we'll be happy to walk you through any other questions. So I think this is a great resource available for not only our school systems, but our child care facilities as we try to identify close contacts and who needs to be quarantined and those type of decisions that we're all having to make now. So I'm happy to stay on and answer any questions. If any come through in the chat, y'all just feel free to let me know. And if you have any other questions, you can email LDOE COVID-19 support@la.gov. And I will be happy to answer your question or find someone who is probably, a medical degree or a scientist, something that I am not either, but I feel like I am some days. So they will be happy to answer your questions if we can't. So thank you so much for having me and letting me share this opportunity.
Thank you, Meredith. We appreciate you hopping on and walk everybody through that. I think, as you said, this is a great resource for folks to have at their disposal. So we hope that everyone who wants to takes advantage of this, and we will make sure that you all have this PowerPoint so that you can utilize the links and that you have the information to reach out to whomever the appropriate person is for your question. So thank you, Meredith. We appreciate you.
Happy holidays.
All right, so we have some COVID-19 updates. One is just to let you all know that LDH has provided a variety of information regarding the vaccine now that we are seeing that light at the end of the tunnel, and childcare is in priority 2 of the vaccine distribution. And so here we've provided some links to the social media campaign from LDH, but also the vaccine FAQ, and then another document called What You Need to Know About the COVID-19 Vaccine. So just want to encourage you all to check out these resources and learn more about the vaccine. And you'll see that childcare, the childcare field, is included in phase 2. So, and you see that here on this slide, the spread between phase 1, 2, 3, and 4. And you'll see that very first bullet, K-12 teachers and school staff and childcare workers are included there in phase 2. And this is a result of Superintendent Brumley requesting, as he said earlier, that 166,000 vaccines be prioritized for birth through grade 12 staff and teachers. So the next slide just talks about the update on quarantine guidelines. So the LDH has adopted the CDC recently updated guidance. And as a lot of you have probably already heard, this shortens the quarantine period from 14 days to 10 days, RSU as 7 days with a negative test. So this is an update to let you all know that we are working closely with LDH and other medical professionals who have been consulting with us throughout the pandemic to update the guidance. If there's any further clarification that we need to provide, we will let you know, and we will be updating our documents and our guidance to reflect this. So as usual, feel free to email LDOE COVID-19 support at la.gov if you have any clarifying questions about these updates. And once again, I'll remind you, if you have a question right now, feel free to enter it in the chat. We'll see if we can answer it. And if not, we'll make sure to get back with you later. LDH has developed a flow chart to determine whether symptoms of illness are due to a cold or allergies or something more serious. I think this is especially important. I know a lot of our kids are walking around right now with runny noses and sneezing. And so we have a whole lot in the air and mixing around us right now in this season as we're all kind of staying inside a little more. And so I think this flow chart could be especially helpful for you all if you would like to distribute it to your families or like to display it somewhere outside your center. This document you might find helpful. It's a nice little chart to help you think about, is it COVID-19, the flu, cold, or allergies? And this is another resource we just wanted to make sure that we shared with you all. It's a really pretty and colorful infographic flyer titled Mask Up for Louisiana. And it includes information about selecting, wearing, removing, cleaning of masks. Again, this is a flyer that is available from LDH that we have linked here that all of you are welcome to view and to use as needed in your facilities. And so the next item on our webinar for today is some business tax considerations. We know this is on everyone's mind as we close out this year and head into the end of the year and the beginning of next year. All of us are thinking about tax, and you all especially are thinking about your business taxes. And so we are very fortunate, again, to have another guest speaker with us today. Mr. Alan Young has offered to walk us through some of the things that he's considering right now in his business that I know he's willing to share and give that perspective and expertise with everyone else on the call today. So Alan, are you there, and are you able to unmute?
Can you hear me now?
Yes, now you're good.
All right. After consulting with my CPA, we discussed a lot of ways to make sure that if, especially in light of the fact that when the last LCAP grant came in, that the last thing we want to do is take any of these critical resources and pay them back in federal tax liability because we may have some profits on the books. And this is more specific to entities that are private for profit. So there are a couple things that you need to really look at before the end of this calendar year. And one of them, and we'll just go down the list, is you need to reduce your tax liability. You need to be really, really concerned about that. You are able to give, you have to give it during this calendar year, the way the law is written. You are willing to give up to $5,000 of expected state of Louisiana tax liability to your local R&R. And what you're doing is you're directing that $5,000 in taxes up to that $5,000 limit to that R&R. So if you anticipate, after consulting with your CPA, that you're going to have more than a $5,000 or even a $3,000 tax liability this year with the state of Louisiana, you can actually go ahead and make that $3,000 donation to your R&R, and it's a dollar for dollar reduction in your tax liability. And that's just a way to direct your tax payment, if you will. But the way the law is written, you have to do it in this calendar year in order to it apply. You cannot do it at the time when you file your taxes in the spring. So that is one of the things. If you know you're going to owe taxes, Up to $5,000 can be given to your R&R, and it's a dollar for dollar reduction in what you owe. So that's a very, very good thing. The other thing is if you anticipate having profits this year that are going to carry over, and part of that may be due because of the LCAP grant and when it came in, any expendables, resources you can do to buy goods and services, and let me cover that: paper towels, toilet paper, can liners, canned goods, anything you can expend this year that you know you're going to use in the first couple of months of next year. If you spend those funds this year, it's written off because those are consumables, and consumables don't stay on your books as taxable liability. So you can reduce the amount of cash you have actually in your accounts and utilize those resources through the first couple next month. Same thing with utilities, specifically maybe a trash collection. If you can prepay several months of that, if you have the funds available, then that's just cost you will not incur for the first couple of months. The next one is rental expense. And of course, you'll need to check if you do rent property with who you're renting from, if they will allow you to prepay a month or 2 or 3 months of rental expense. Once again, those are just expenses you will not incur the first couple months of next year. And therefore, when you receive your revenue coming in, you just won't have to spend those funds, and you'll see your checking account rebound and build back up as well. And the other one I would say is long-term liabilities. And this one I really would tell you to go to your CPA to look at it. And specifically, if you have your insurance on monthly payments, and you may have 3 more payments that are due in the fiscal year of 2021, you may want to look if you have the resources available to go ahead and pay those 3 months, because that is a direct expense. It's 100% written off, and that will reduce your overall profits for this year and reduce your potential tax burden. Remember, LCAP grants are taxable income. PPP was taxable income. If you received the Louisiana Main Street Recovery Grant, that's taxable income. If you received any grants via your local network, those are taxable revenue. So you have to keep all that in mind, that that you very well may be looking at a taxable situation come the end of next year. And I think the minimum rate is actually 21% taxes. So get with your CPA. Please do not go into the next year and have to write a large substantial tax check to the federal government when you could have expended those funds this year and saved that amount of money in taxes. So I think the minimum is 21% now on taxes. And so you don't want to get hit with those tax liabilities and tax burdens. The only other thing I want to cover, and I don't know if I think there's a single slide, is if you had a COVID-related shutdown, either in a class or as a whole, you are allowed up to 80 hours of an employee to get that recovered on your 941 taxes. And it would be best if you actually did it before the end of the year, because then you're getting into filing for your tax returns. And what happens is, and I'll give you my example of what happened with me. We closed a whole week early on because of a COVID exposure, and that was the guidance we got back then. And so we were closed a whole week. I had to get my CPA to go back and modify my 941 filings. And we also had one other time where one employee had to be isolated for a week. Between those two, that week and that one individual day, I'm getting about $14,000 back on my 941s. This is what happened. This was passed in the one of the early CARES Acts, and it allows you to get a credit back on your 941 taxes. It's $1 for dollar of payroll expenses, with the exception of matching Medicare. So it's $1 for dollar. So if your payroll that week was $5,000, you get your matching FICA taxes added to it. I'm just going to use round numbers, $5,300, $5,400, somewhere around there. That you can actually get as a check back to you because you paid those payroll expenses out. You had to incur the payroll expense, but you get those funds back. Do not let this slip away, because if you had to close, then you can get those funds back, and you can actually get it as a refund on your 941s. They will actually send you a check back as well. So please do not let that get away from you. Go to your CPA if you closed, show them the hours and the weeks you closed, show them the affected employees that were closed. They can amend your 941s for those quarters, and start that process of getting those funds back to you. This is a federal law that passed, and please take advantage of it. And unless somebody throws up any questions, I will go back on mute. And that's all I have. Thank you.
Alan, thank you so much. I'm not just saying, I really, really mean that was super helpful. I know for so many people, the people who are on video, I see them taking notes. So thank you for that. I know that was really helpful for everybody here. We appreciate your time in talking everybody through that.
Jenna, can we ask Alan this question from Bright Beginnings?
Sure.
Is there documentation on the federal law and the 941 credit to share with our CPA in case? Alan, are you able?
Yes, I'm sorry. Lisa was doing her due diligent job. She put me back on mute. I believe that we gave the Department of Ed a copy of that, and I'll get with Lisa Burchard, and if not, I'll see if they can maybe send that out. But yes,
I think I dropped it I think I dropped a link in the chat box.
Very good.
And that, I think that's
And this
it.
is, by the way, this just doesn't apply to us. This is to any business. So if your family, a spouse owns a business or whatever, and they incurred the same cost factors, they're eligible as well. It's any business that is eligible for this. And so please get with your CPA and try to do it before the end of the year, before they get ready to file your end of year reports, because I don't know if it's more difficult, but I think it's always better to do it in the year it actually occurred as opposed to letting the year end.
Okay. And Alan, we have another one. Does that still apply if you paid your employees with PPP funds while you were closed?
Yes, it does. Actually, that's kind of the irony is because they overlap each other and they don't care. The actual week that I was closed was a PPP week that I was using payroll. And what happened was early on when the people that first got PPP, you literally had to start within so many days of getting the funds. And then of course, when they passed the next CARES Act, they actually modified the program so you could actually go from 8 weeks time of using PPP money to 26 weeks, I believe it was. And so it became very, very broad. And so, yes, they overlap and you can use it for the PPP week because the PPP week now is not limited to 8 weeks. It's very, very broad. So when you go in to do your forgiveness, you can do an 8-week window or a 26-week window. And what my bank is telling me is they're encouraging everybody just to file for it under 26 week of payroll. Most people can cover their full PPP liability with a 26-week window, easy. So yes, it does not matter. Does not matter.
Anything else, Leslie, for Alan and on that topic?
That's all the questions from the chat.
All right. Thank you, Alan.
You're welcome.
And thanks y'all for asking those great questions.
I'm sorry, I just got one in. If you did not close but reduced staff, can you still claim?
Did you pay them? Well, back up. The requirements are you had to send somebody home because of a COVID either infection or a COVID exposure. That parameter is there that you had to send them home for that reason. If you just simply furloughed them, I don't check with your CPA. They have the specific guidelines on that. What I remember reading, it had to be either actually due to COVID or actually due to a COVID exposure, and you were recommended by your local Department of Health or CDC to actually close. And that's what happened in our case. Our local CDC people said we needed to shut down and quarantine. So that's what we did.
Thanks, Alan. And I just want to encourage everyone, Alan is so knowledgeable and has done a ton of research on this. But to his point, make sure to check with your own CPA. Everybody's situation is really unique and different in context. So I think one of the most important lessons here is that there's lots of availability and a lot of fluctuations that happened this year, to Alan's point. And so I think he's really framed up a lot of great questions for you to bring to your CPA and dig more into. So thank you for that. All right. So we have some program updates that we will dig into next. So just a reminder, as we announced a few weeks ago, that we are extending CCAP payments to providers based on enrollment through March 31st, 2021, but we are still requiring providers to use either the TOTS device or the IVR system to track attendance. Failure to do so may jeopardize provider payments based on enrollment. And like we talked about last month, this is simply because we have to have some evidence and proof of attendance, even though providers are being paid on enrollment through March. So it's important for us to be able to provide that with this funding. So just a reminder to use those devices to track attendance. The department has added an eligibility criteria for CCAP in an effort to offer childcare while families are searching for work or enrolling in school. So per Bessie Bulletin 139, if the head of household or any legal custodian is actively seeking employment and or training, including enrolling in school, the ENT requirements may be waived for 90 days. Just a reminder, the household must meet certification requirements and validate that they are actively seeking employment with the Louisiana Workforce Commission. And if eligible, the family may qualify for CCAP for up to 90 days while they are either looking for work or enrolling in school. An update on childcare criminal background checks. Of the 30 fingerprint locations across the state, 5 remain closed due to COVID. Some locations, remember, like we've been saying, they may close unexpectedly due to potential COVID exposure. I think we're seeing that in all sectors and all businesses right now. So of course, it's best to call the nearest location in advance to make sure that they are still open. If the location you normally use is closed, we encourage you to use the fingerprint location list that's linked here on this slide to find the nearest alternate location. And just a reminder, department fees will continue to be waived through June 30th. And the department is working with the fingerprint vendor and the state police to offer more locations in 2021. A food and nutrition update. Providers may consider applying for the Child and Adult Care Food Program, CACFP, in an effort to assist with food costs. And this would consist of 2 meals and 1 snack or 2 snacks and 1 meal per day. So for type 2 or 3 early learning centers, these locations would qualify if 25% or more of enrolled children are eligible for free or reduced meal pricing. And the Family Daycare Home Food Program, family home childcare for up to 6 children under the age of 13. All programs are reimbursement programs. Organizations are reimbursed on a per meal served basis. And the funding is designed to be used to provide healthier meals to children. And it can support the food, but also costs associated with preparing the food, like equipment and labor. So please feel free. We have 2 numbers at the bottom of your screen. Our LDOE, Division of Food and Nutrition, is happy to help you if you have any questions with the Child and Adult Care Food Program. The department is working closely with Feeding Louisiana to help address the need of feeding. We know that this is an issue for a lot of families across our state who are facing a lot of difficult and challenging times with keeping food on the table for themselves and for their children. So these are the food banks we've listed out by region. And so you can feel free, according to where you reside, to contact them at the numbers provided on their screen, or you can visit feedinglouisiana.org to find a nearby food bank. We really encourage you. I know I've heard Lisa say this a number of times, that we encourage you all to get creative with how you can think together with food banks as partners to create some solutions, things like delivery options, maybe delivery to your facility for families when they pick up their child to have some food waiting for them as well. So think creatively, work as partners with these food bank locations and organizations to make sure that we get our children fed. We have a few teaching and learning updates today. And so I am happy now, Taylor, if you're there and ready to talk us through a few teaching and learning updates for today.
Absolutely. Thank you, Jenna. And good afternoon, everybody on the line. Before I jump in, I just want to echo everything that Dr. Chasson and Dr. Brumley already said. We at the department are so grateful for all of the work that you all have done these last few months to continue to serve and provide high quality early care and education to children and families in our state. We know it's really, really challenging and difficult work, even in the best of circumstances. And this year has not been the best of circumstances, to put it lightly. So thank you on behalf of the early childhood team at the Department of Education. We are always inspired by the work that you do, and it really motivates us to do our jobs as well. Jenna, I don't think I have slide control, so if you could move on, perfect. So we want to come with you with a little bit of a preliminary look into what class observations were looking like this fall. I want to note that this is very preliminary. This only reflects observations that were conducted up to December 1st of this fall, so does not capture observations that were conducted during the last 2 weeks of the observation period. But looking at the preliminary analysis of the class observations that were conducted across the state, we are actually continuing to see an upward trajectory of average scores on both overall and on each of the domains that the class tools measure. I think, we didn't really know what to expect. And I think we at the state level, we're sort of bracing ourselves for maybe some stagnation in scores, or maybe even a decline in scores for the first time ever since implementing class. But so far, that is not what we're seeing. So, more to come, more analysis on this to come, but this early view into continued improvement is just testament to all of the hard work of you all on the line, of teachers across the state, of childcare directors across the state. So this is very exciting for us. Now it looks like I do have slide control. So I do also want to just remind everybody of the improvement supports that we have in place across the state. So for our lowest performing sites in the state, there is a formal site improvement planning process in place. And this year, the department is supporting 52 sites that were considered low performing based on their 2019-2020 results. So those 52 sites are going through a relatively intensive improvement planning process in partnership with CCR&Rs, as well as our field support consultants who work in the field, but our department staff. Also, of course, you all have access to childcare resource and referral agencies. And I do want to note that CCR&Rs across the state have begun to sort of shift their services to various formats, and really are working to accommodate the childcare centers that they work with to ensure that the format of their supports feels safe, feels appropriate, feels comfortable under the current circumstances. So supports are taking place virtually, supports are taking place over phone conferences, and there have been in-person supports taking place this fall as well. And then last, I also want to just note that despite the challenges, we continue to see early childhood educators in the state take advantage of the Early Childhood Ancillary Certificate, or the ECAC, and we continue to be able to release scholarship funds to provide for the costs of those ECACs. So that's really exciting as well. I also want to make a note that we have expanded our state contract with Tulane to offer mental health consultation. And we've also expanded the contract to allow for type 1 and type 2 centers to take advantage of this really, really critical service at a time when we know so many providers, so many families, so many teachers and caregivers and children are experiencing trauma related to COVID-19. So if you have not already, we encourage you to take advantage of these supports that are available to you. And I just want to update you on a change that was made to in-person observations and coaching visits this fall. So what is now probably not a surprise to anyone on the line, as a result of rising COVID numbers right around Thanksgiving and right after Thanksgiving, we worked with the Department of Health, Office of Public Health, to put in place a plan for the remaining in-person visits that were scheduled to take place in the later weeks of December. And we began canceling in-person observations and coaching visits across the state. And then where it was possible and practical, lead agencies, PCARD, and the CCR&Rs across the state worked to reschedule those observations and coaching visits as virtual. So using virtual platforms like Zoom or recorded video, they've begun to shift the model and platform to virtual. I will say we don't know exactly what the future holds, but we will continue to work with the Department of Health to determine when it's appropriate to resume in-person observations and coaching visits. So we hope to have more information for you on that in the early part of spring. So hopefully right after the holidays, we'll have more updates about what these coaching visits and observations will look like in the spring semester. Then I'm sure anytime we talk about class observations, I want to also talk about what we're thinking currently for early childhood performance ratings and performance profiles for the 2020-2021 school year. So one update that we do want to bring to you is that BESI, the Board of Elementary and Secondary Education, has approved a one-time emergency rule just this week at the December BESI meeting that will allow any classroom that received a fall local score or fall score after third-party replacement of 4.5 or higher on class to be exempt from a spring local observation. So if you have a classroom at a site that scored after any third-party replacement 4.5 or higher, you do not have to have that classroom observed by local observers in the spring. This is really an attempt to help community networks and lead agencies redirect their efforts and funding to support low-performing classrooms. So we know that many classrooms are struggling right now, and so we really want to redirect those efforts and any funding available to support classrooms that are continuing to struggle. I want to note that classrooms that do opt out of receiving a local observation may still be randomly sampled by PCARD in the spring. So this does not necessarily absolve you from a PCARD observation, but it would absolve you from a local observation if you chose to. So we'll provide more guidance on what that will look like, but the lead agencies will be working with sites to determine whether or not sites will be opting out of these local observations for classrooms that scored 4.5 or higher. Then I would also say that I think in order for this information to be really actionable and useful for you all, you also need to know how the 2020-2021 performance ratings and star ratings will be calculated. So we're planning to get really busy in the next couple of weeks and do some more thorough analysis on the class data captured this fall and come back to you hopefully early January or mid-January with more clarity on how we plan to calculate performance ratings and star ratings. And I know that we've said this to you all before, but I just want to say it again, that we are exploring opportunities for performance ratings that would allow you all this year to demonstrate continued improvement, because we are seeing some sites improve from previous years, and we want to create an opportunity for them to demonstrate that, while also not overly penalizing sites that have really struggled this year with circumstances out of their control and related to COVID-19. So anytime we talk about accountability, I think it's a little scary and it's a little worrisome, but we're asking for you to just hang on with us for a few more weeks, and we hope to have a lot more clarity in January. Okay, we also have an update that was approved at the December BESI meeting to eligibility for staff school readiness tax credits. So in a typical year, in order to be eligible for the staff school readiness tax credit, that's the director credit or the teacher credit, the individual has to demonstrate that they were working for 6 months at the center. We know that as a result of layoffs or a result of closures or a result of individuals having pre-existing health conditions that results in them taking themselves out of the workplace for months in order to keep themselves and their families safe, that 6-month requirement may have been challenging to obtain. So we've worked with BESI to pass an emergency rule that's a one-time rule that says, due to the COVID-19 pandemic for the 2020 calendar year only, a director or staff member will only have to verify that they have worked at the same center for at least 300 hours. So that's cutting the hours requirement down from that 6 months to 300 hours. And that will be, just to restate, only for the 2020 calendar year. So this will be retroactive, looking at employment that occurred during 2020 and will not impact 2021 tax credits. I also want to just remind you all that for individuals applying for their ancillary certificate in this calendar year, this tax year, in order to be eligible for higher school readiness tax credits, you must, and I really want to emphasize this, work with those individuals to submit their application for their ancillary certificate as soon as possible and absolutely no later than December 31st. So if applications are submitted on January 1st, that will not count for the 2020 tax credits. And we really want to convey to you and stress that you should work with these individuals applying for their ECAC to submit their applications today as soon as possible, because as we get closer to the end of the year, we cannot guarantee they'll be processed by the end of the year. So for example, if you submit an application on December 30th for an ECAC, but some of the documentation is missing or there have been errors made in the application, it's likely that will not be addressed until the 2021 year, making that individual not eligible for the 2020 school readiness tax credits with their ECAC. So please, please, please act quickly here. If you're applying for your ECAC, submit everything as soon as possible. If you have teachers applying for their ECAC, support them to submit everything as soon as possible. And we hope to process all of these by the end of the calendar year. And then just a quick update on Teacher Leader Summit. So we are very excited to announce that we're planning the 2021 Teacher Leader Summit that will take place in New Orleans at the end of May in 2021. As of now, we are planning for this to be an in-person event, and you can apply to lead a session at the Teacher Leader Summit. Applications to apply to lead a session are due by January 6th, 2021. We think this is a really great opportunity for you all as childcare directors or even staff at your childcare centers to share your expertise with other members of the early childhood field in the state. So please take advantage of this opportunity and apply to lead a session. If you have any questions about this event, please contact LDOE-events@la.gov. And then registration for the summit will open on January 8th. So that deadline by January 6th is just if you want to apply to lead a session. And we'll release additional information on how to register as an attendee in the spring, and that registration will open on January 8th. I'm struggling to change the slide. So there we go. So I will now turn it back over to Jenna, who I think is gonna wrap this up.
Yeah, thank you, Taylor. We want to take the opportunity. We have the team working feverishly in the background to answer your questions that are coming in through the chat. And we do have a few of those, so we want to acknowledge them and make sure that we're getting them answered. Our wonderful team is in the background pulling together to get those answered for you. So we did have some come in. We also had some that were directly answered in the chat. So if you asked a question, I know Lisa, I see Lisa and Taylor were both answering as we went along. So thank y'all. So if you have a question that you put in the chat, it might have already been answered, especially if it was a link. I see we have a few links that were popped in there. So please check the chat because you might have already been answered there. And there were a few questions that I'll go ahead and voice over right now with some related answers. So one question is, will LDOE send a W-2 to the business to file in regards to the LCAP grants? And the answer is the LCAP grants will be incorporated into the 1099 that you receive from LDOE. So you will see that noted on your 1099. A clarifying question about CCAP payments. Will CCAP max payments be paid until March? Also, yes, CCAP will continue to pay the max rate per age of the child based on enrollment until March 31st, 2021. So to clarify there, we are paying on enrollment, but CCAP will continue to pay the max rate per child, per the age of the child based on enrollment through March. I know folks still have some lingering questions and are seeking more information about the COVID vaccines for you and your staff. And what we gave today is what we have at this point from LDH. So just wanted to assure you that as we get more from LDH and our partnership with them, we'll make sure to pass it on to you. So more information will be forthcoming as we receive more and go further down the line, and actually, I'm sure, get closer to being in phase 2 of the vaccine priority structure. We had a question about fingerprint locations. How is the department working to ensure that sites have access to fingerprint locations for new staff to receive their child care criminal background checks? So we are working really hard. You know, we have a really hard working team on the child care criminal background checks. They're working hard on setting a date for mobile fingerprinting in January and February. We're also working with the vendor and the Louisiana State Police to deploy more permanent locations in each area. So I know more information about that will be forthcoming as we have it available. So we're still trying to secure more locations around the state. We know that's still a struggle in some particular areas. And then we had a question come in around families getting finger images completed at various locations due to closures related to COVID-19. So that's about the TOT service locations. So presently, most TOT service locations are taking appointments for finger imaging due to COVID-19. We ask that you please email jackie.drotty2@la.gov. And I know someone can please, Lisa, would you please type that in the chat? Thank you. She'll type in Jackie's email because it is a little tricky because you have to have that number 2 on the end. So please email Jackie for assistance on current TOT service locations. And we'll also pop the link to the current TOT service locations. And that link does have the most up-to-date information. We had a question come in around ECAC. Do you have to have the ECAC in order to qualify for the school readiness tax credit? You do not need to have the ECAC in order to qualify for the school readiness tax credit. but you must be enrolled in the pathways. And teachers who have the ECAC are automatically leveled into level 2 when they enroll in the pathways. So we have some more questions coming into the chat right now. So I encourage everyone to type their questions in, anything that you need. Now's the time. If we can't answer it, if we know the answer, we will. So go ahead and type those in the chat right now. And I'll just remind you all that we have the contact list posted right here on this final slide as usual. We have phone numbers and emails for licensing, for the CCAP team, for child care provider certification, child care criminal background checks, and then just our general early childhood email address. So those are really great ways to reach out to each team in particular with any of your specific questions that you have. We'll go ahead and pause for 1 minute as we let some more questions come into the chat and get those answered. All right, so to go ahead and round this out, I know we're past the top of the hour. And so to answer a few more questions, we had the question, will an unofficial CDA certificate be accepted for ancillary certificate application? And the answer to that is no, unofficial documents will not be accepted. So to contact certification with additional questions around applying for the ancillary certificate, please visit Teach LA Live's website. And we have that linked through early childhood as well. So we can pop that link into the chat, but that's the Teach LA Live website where you can find out what documentation is required. And we had two more questions comes in, one about a 16-year-old being hired as a childcare teacher. Yes, a 16-year-old, just a reminder, can be hired as a staff member and must work under the direct supervision of an adult. If you all remember, this was a waiver that we put before Bessie, and thankfully they approved that a 16-year-old can work under the direct supervision of an adult. And this was waived until January 31st, 2021. And another question about, is the quarantine 10 or 7 days? What about if a parent is testing positive and still taking care of the child? How long are the additional days for the child? And so for those specific questions, we ask that you contact your local health unit for specific and intricate quarantining questions. I know it gets really difficult when you're trying to decide. We've been going through some of those same things when you're trying to decide, this person has it, so who has the quarantine, who's been around them or lives with them for how long? Some of those questions get really detailed and technical. So at this point, we are past our hour. I actually wanted to kick it to Lisa to close us out, if you don't mind. Lisa, are there any lingering updates or reiterations you wanted to give everyone before we close out for today?
Thank you, Jenna. I think, I just want to thank everybody for all of the hard work you guys have done throughout this last year. We're closing out our calendar year, and I look back at, the craziness that we had back in March, and all the things that we knew, many of the things that we didn't know, right? And you guys just have hung in there with us. You guys have hung in there with your families, your children, your staff throughout all this. And so I just want to take a moment just to thank you guys for all of the work you've done, all of the help that you guys have given us as well. There's many times we've reached out to you guys on various things, and you guys have given us, great feedback. But, we're in this together. We can see the light at the tunnel. We're almost there, and we'll get there. So again, just thank you guys for everything.
Thanks, Lisa, and thanks everyone for making today possible, this webinar. Special thanks to Dr. Brumley for being on today, for Meredith McGovern, and to Mr. Alan Young. Thank you all for being special guest speakers. Thanks to Taylor and Lisa and all of the team behind the scenes who helped make today possible. And thank you all for joining. I hope y'all have a wonderful rest of your day, and I hope you all get that well-deserved break and some time to relax and recharge. And we'll see you all in the new year.